Good afternoon, everyone, and thank you for joining our webinar today. I am Dr. Sandra Lowe, Medical Director of the World Trade Center Mental Health Program here at Mount Sinai. And before I introduce our speaker, I want to make sure that everyone is aware that you can ask questions through the QA function at the bottom of your screen, and we will make sure to address them after the presentation. Our speaker today is Dr. Kendall Pfeffer. She's a clinical psychologist with our program who specializes in post-traumatic and chronic stress and works with individuals, groups, and couples affected by trauma. Through her clinical work, Dr. Pfeffer has witnessed the long-term impact of trauma on responders and on their families. And today she will speak about silent pain. Silent pain is the less visible ways that stress and trauma can gradually affect our emotional well-being, our relationships, and our connection to the people and experiences that give meaning to our lives. This is a really important topic because one of the challenges that we face in trauma care is that suffering is not always obvious. Typically, when we think about emotional distress, we often picture the classical symptoms such as anxiety or panic, irritability, or nightmares. Yet, one of the most important lessons that we have learned caring for 9/11 responders is that the psychological effects of trauma do not look the same for everyone, and they do not follow any sort of predictable timeline. For many, the impact unfolds quietly and persistently over decades. One of the reasons is that many responders spent the years after 9/11 in what we call survival mode, focused on work, on raising a family, on managing the challenges of daily life, and sometimes managing progressive medical illness. And they did what they have always done. They kept going. At a certain point, though, the very coping mechanisms that initially helped, things like perseverance and self-reliance and just kind of pushing through difficulties, also made it difficult to recognize when support was needed. As a result, many responders have carried symptoms quietly for years, not realizing that some of the signs of traumatic stress can be really subtle and easy to overlook. Signs like withdrawing from others, feeling emotionally numb, losing interest in activities that you once enjoyed, or becoming disconnected from loved ones. These experiences may resonate with you, and these are the very experiences of silent pain that Dr. Pfeffer will discuss today. Most importantly, she will offer some practical strategies that help people to reconnect with themselves, reconnect with others, and with the sources of meaning and purpose that support our well-being. I really want to underscore that healing can occur at any time, no matter how much time has passed. And often this begins by rebuilding connections. So please join me in welcoming Dr. Pfeffer. Kendall, thank you for being here today, and we look forward to your presentation.
Thank you so much, Dr. Lowe. I'm going to get the slides ready for us to get started. Okay. I'm going to speak today about silent pain, as Dr. Lowe mentioned, and something that I want to start with, as this initial slide has a backdrop of the New York City skyline, is just to take a moment to thank all of you for what you've done. One of the things that I hear so often from my patients in individual therapy and in group is this experience of being forgotten, that as we move years and years from the 9/11 attacks, that people are forgetting. New generations weren't alive or were young and don't understand what happened, don't understand the cost and everything that was asked of responders. And I think that feeling of being forgotten is something that can be a heavy burden that really contributes to this experience of silent pain that we're going to speak about today. And especially as time goes on, and you may still be carrying some of those burdens, some of the long term impact of the trauma of 9/11 and the weeks and months that followed and what was asked of all of you. And so I just want to take a moment to acknowledge that and thank you. And I think that's something to keep in mind in terms of the burden that continues even many years later as we're coming up on the 25th anniversary. So before I start, just want to take a very brief moment to note that I don't have any conflict of interests regarding the presentation today, and that the contents of my presentation do not represent the view or any endorsement by NIOSH or the CDC. So what are we going to dive into today? So first, we'll talk about this idea of silent pain. So stress reactions that are normal and common, but are quieter and easy to miss and often go unnoticed by friends, family, loved ones, doctors, but even by ourselves, even might be hard for you to notice. And then why these coping strategies develop, the ways that they are adaptive in the short term, and then the long-term impact of them, the kinds of costs that come with the short-term adaptation. That silent pain can lead to disconnection over time and can really start to impact relationships as well as our internal world. And then going to some practical things that you can do, as Dr. Lowe mentioned. What can help? Practical steps. First, to reconnect with yourself, which often the disconnection starts there, and then reconnecting with others, feeling more like yourself. So, what is silent pain? What do we mean when we say that? And there's this idea that um, pain might be visible or obvious. So the kinds of, as Dr. Lowe said, classic symptoms of post-traumatic stress, classic reactions to trauma. These are things like anxiety, irritability, anxiety that kind of lives in our body. We might be restless or agitated. And these things are really visible. They're observable to people we know. It's hard not to feel them. Panic symptoms, physical symptoms of anxiety in the body. They're loud, they're overwhelming, and they're quite powerful. And it's hard to miss them. But then there are also reactions to trauma that are quiet and go undetected by those around us. So in this image here, you'll see these kind of more kind of classic or recognizable post-traumatic stress reactions above the surface of the water. So these are the things that might be visible, obvious, hard to miss. So anxiety, whether that's kind of a generalized anxiety, a general worry, planning for bad things that could happen, trying to anticipate. Also physical symptoms of anxiety. So that can look like difficulty breathing, heaviness or sharpness in the chest, sweaty palms, agitation, jitteriness, and then panic symptoms where there is the sense that something bad is happening, can feel like completely out of control, hyperventilation, where those anxiety symptoms really ramp up. And irritability. So what happens when when there's a traumatic stress event like 9/11 is our body prepares to respond, and all kinds of hormones get activated in our body. Our stress response system turns on, and one of the things that can show up there is irritability because there's so much happening in our body, and that can lead to difficulty communicating. What can seem to others like impatience because there's agitation, because there's anxiety under the surface. And hypervigilance, kind of being attuned to your environment, monitoring, looking for threats wherever you might be, finding the place in a room where you can watch the exit, know who is entering and leaving, be aware of any threat that might arise. And of course, this comes with impacts in the body, things like jumpiness, quick to startle when there's loud sounds or touch, restlessness, difficulty sleeping, nightmares. So these are all the post-traumatic stress reactions that live above the surface that we are aware of. Others will notice things, might say something, and they, because of that, can be a little bit easier to identify and talk about. And then below the surface, under the water, are these quieter stress reactions. To start kind of feeling detached from your body. And that can be a kind of broad range of experiences, anything from almost feeling like you are outside of your body and you're watching things happen, or just being disconnected from physical sensations and feeling more like you're in your head. Emotional numbness, and that kind of goes in both directions of difficulty maybe feeling more intense emotions like anger, sadness, and it's more numb, but also importantly, difficulty feeling positive emotions, feeling happiness, feeling joy, feeling excitement. And because of that, there's difficult low motivation. When we feel numb, it's hard to motivate. It's hard to do tasks or activities that we would otherwise enjoy or that are important to us. Brain fog. So, this idea of kind of zoning out, where you might have difficulty maintaining attention, you might be distracted easily, you might have moments where there's gaps in your memory or where you're kind of lost touch with what was happening. And there's a sort of fogginess to your experience. And exhaustion even when you do sleep, even if you feel like you're getting enough hours of sleep, but you're still feeling tired, your body still feels heavy. And again, that will contribute to difficulty motivating. And of course, when you're feeling all of these things, hopelessness can enter the picture of not knowing how to get out of this, not knowing what's wrong, and feelings of emptiness. So we're going to focus today on these reactions that are below the surface, the ones that are quieter, maybe hard for others to notice, and that you then carry on your own and can carry on your own for many years. So to start, just want to make a note before we talk about why these reactions develop and how they develop, to talk about what they're signaling to us. So oftentimes reactions in our body are kind of a cue to pay attention. And so these quieter ones, if they continue for long periods of time, do tell us that something needs our attention. Short term, they're normal, adaptive, and quite common, and we'll talk about that. So feeling disconnected, that can be things like this emotional flatness or numbness that I mentioned. Feeling a sort of distance from others, feeling cut off, even if you're physically present, if you're in the room, having dinner with family, doing things with friends, loved ones, that you still feel a certain kind of distance and loneliness. And then losing interest and motivation, whether it's activities you enjoyed that you no longer feel enjoyment for or toward, or motivation to start, or activities that provided fulfillment, meaning, purpose. Another signal is withdrawing, pulling back from people in your life, from important relationships. That can look like avoiding calls, not calling people back, declining invitations, backing out of things last minute, and just being in survival mode, kind of being in an autopilot where you might be still functioning really well. You might still be doing all the things, going to work, being there for family, but you don't feel alive in it. There's this autopilot, survival mode that comes with a loss of sense of meaning or purpose in your life and difficulty feeling excited about your future. So all of these things are a signal to us that something needs our attention if they continue and persist over time. So how and why do these reactions develop after a traumatic event like 9/11? So important to say that stress reactions don't look the same for everyone. So I want to bring our attention to this graphic on the right-hand side, how trauma can affect your window of tolerance. So to start, I want to just describe what is meant by this idea of window of tolerance. So this is the kind of zone in terms of how we feel, our mood, our energy, our motivation, where we feel like we've got it. Doesn't mean we don't have stress or pressures, but that we feel capable of managing them. The kind of resources we have in our life are up to the challenge of the kind of daily stress and pressures of life. And kind of when we're in that window of tolerance zone, we feel effective, we feel competent, we feel capable, we are able to think clearly, we feel maybe a little touch of anxiety or stress, but relatively calm enough to problem solve, make good decisions. And what happens with traumatic events like 9/11 is that sometimes, if we are in a circumstance where the threat does not go away, so there's the immediate attacks, and then there's the days, weeks, and months afterward where there is persistent threat and our body is adapting to the threat. Our stress response system that pushes hormones through our body to prepare us to respond. You often hear the phrase fight, flight, or freeze. So the kind of hormones in our body that prepare us to do one of those things, whichever is most adaptive or effective for the environment. We stay in that mode. We stay in that zone because the threat's not leaving. And when that happens, the window of tolerance can shrink over time. And we spend more time in these two categories that you see above and below, hyperarousal and hypoarousal. So hyperarousal is when your body is responding to a threat and intending to fight or run away. And importantly, these reactions, when it's a threat, are automatic. It's our body's kind of defense mode. So they happen without our conscious control. It's not necessarily something that we can, in the moment, have discipline or willpower and have control over. So the body responds as if to run away or as if to fight the threat. And so in that category, we'll see these louder symptoms, the more obvious symptoms, the ones that were above the surface on the iceberg. So anxiety, anger, irritability, hypervigilance, feeling out of control. It can start to feel out of control when we feel that way for long periods of time, and it can feel overwhelming. And then below the window of tolerance graphic, you see hypoarousal. And that's the body's response when the threat is not something that we can fight or run away from. And so the threat of what could have happened, the experience of trying to find people, trying to help family members, trying to provide some solace to those, trying to rebuild the city, trying to bring life back to normal, and being down at ground zero or at Staten Island landfill or in the area surrounding downtown for weeks and months at a time. There's no threat that you can fight directly, and you're not going to run away because you were there to help. And so the body can start to enter this shutdown mode where there's more of a spaced out, zoned out. Why many people describe having significant gaps in their memory of their response to 9/11. Some things are very, very distinct in our memories, but other things, it's almost as if you weren't there, or complete gaps in memories, emotional numbness. And these things are adaptive because you needed to stay down there. The work took time and you had to keep going. And then that mode continues after. And it's kind of life is supposed to go back to normal. And so I think the key takeaway here is that all of these reactions, all the ones that we talked about that were kind of outlined in the iceberg image, in this category of hyperarousal or hypoarousal, they are all normal and common and adaptive in the short term. But in the long term, they start to carry certain costs. So we'll talk a little bit about that. So here we have an image of the avoidance cycle. So this is a big part of post-traumatic stress. So we'll talk a little bit about some of the kind of symptoms or experiences that we see in post-traumatic stress and what's happening with avoidance. So after a traumatic experience like 9/11, it is very common to be triggered. I think that's something that will feel familiar in some way to most of you. And the experience of being triggered can lead to lots of different things. It can be an explicit memory. So you're thinking about something about your time responding to 9/11. It can be an image where it's just a flash and maybe something graphic, something that was particularly horrific. It can be thoughts, it can be regrets, it can be guilt, it can be anger, it can be emotional reactions. And then we can also be triggered by external things outside of our body. So seeing someone that you haven't seen in a long time, perhaps someone that reminded you of that time or that you worked with, someone wanting to talk about 9/11, seeing something on the news, current events. So all of these things trigger, and then they lead to these what we call intrusive experiences, because remembering something that was deeply painful or horrific brings up all kinds of emotional reactions, both emotional and physical. So the emotional reactions might be things like shock, might be things like fear, might be things like anger about how people responded at the time, or kind of the being forgotten, how things were handled. And then physical reactions, like we've spoken about. This is going to bring up anxiety and fear. And so there will be things like headaches, things like lightness and difficulty breathing, rapid breath, heaviness in your chest, all those kind of cues of anxiety. And so when you feel that, it's overwhelming. And particularly with these intrusive experiences, is the trigger sometimes, most often, is unpredictable or takes you by surprise. It's something that happens really fast, and then you're thrown a wave of these big emotions. So it makes logical and natural sense to avoid the trigger, to say, I'm not going to go to that place or talk about my experiences at 9/11 or think about it. And then you experience short-term relief. You feel better, you feel more comfortable, probably feel more like yourself, more able to go about your day, do the things that you need to do. So then you will learn that avoiding the trigger is going to bring relief, and the cycle starts to repeat. And so what happens with avoidance is that it's really effective in the short term at reducing distress, but in the long term, it can start to stall recovery. And so then it leads to a whole other kind of slew of experiences. Can lead to depression when you are repeatedly experiencing these intrusive memories. It can lead to all kinds of changes in your sense of self. You start to feel overwhelmed. Maybe it's harder to do things. Can have feelings of being a failure or not living up to your expectations for yourself. Can lead to intense emotional reactions. And then all those louder symptoms that we talked about. When you're being triggered frequently, you're going to be in a hypervigilant state. You're going to be on edge. Anxiety, generalized anxiety and worries might go up. Panic might go up, and sleep will be impacted. And all of these things become a challenge in the long term. And avoidance makes it much harder to address some of these experiences. And then this kind of silent pain can impact our relationships. And, the distance that develops in relationships oftentimes starts with a desire to protect, not wanting to be separate or alone or lonely or apart from those you care about, but wanting to protect them. And that can start with a not wanting to burden others when the feelings and emotional experiences and triggers and intrusive memories are overwhelming. It makes sense that there might be a worry that if you were to share what you're going through, if you're to talk about it with people in your life, that they would be overwhelmed too, or an attempt to protect them from your pain. that it would be painful for them to know what you're going through and not wanting them to go through that as well. And I think maybe most importantly, and I see this all the time, is responders have a natural instinct and impulse to care for others, first and foremost. That is the duty to protect, defend, care for, serve, support, and it comes above everything else. And a number of things can happen um, when there is a pattern of caring for others. Can start to neglect your own needs. Some of these kind of quieter symptoms, you might write them off, not notice them, um, not want to share them because it's more important to be there for friends or family, to be there for the people you're serving, to get the job done. And then over time, when you're present for others, the relationships can start to feel one-sided. It might be that you become even more uncomfortable sharing because it's become a habit. But I think more importantly, what often happens is you start to feel alone. That we're there to listen and support and spend time with others, but it doesn't seem like anyone understands or knows what you are going through. And that leads us to the withdrawal cycle. So this is a very similar cycle to the avoidance cycle, but it's relational. It takes place in our relationships. And so it often starts with that feeling of being misunderstood or alone in your pain that no one can understand or very few people could understand. Certainly your kids, your wife, your friends, your doctors, your husband, your childhood friends who didn't go through this. No one is going to understand, and you feel alone and misunderstood. So again, a natural reaction to that is to withdraw. You withdraw perhaps inadvertently from some relationships that make you feel this way, situations and activities that make you feel this way. And then the consequence of less connection, less moments of feeling belonging and social support, love, connection, all those things leads to feeling more lonely, more down, more depressed mood. Um, and when that happens, it becomes harder to reach out, harder to motivate, and disconnection grows over time. And again, this is a cycle that then repeats and we can get stuck in it. And so the disconnection that you might feel fuels the withdrawal, and the withdrawal also continues to fuel that feeling of disconnection. So another thing that I think is important to address here when we're thinking about these silent symptoms, these things that maybe people in your life who are seeing you every day, they might notice something is off, but they might not know what it is or know how to ask, is to consider why it is so difficult to talk about, because there are lots of kind of good reasons that it's hard to talk about. The first being stigma. There are lots of feelings about what it would mean to talk to someone, not just about what happened, not just about the memories that are hard and painful and shocking. That in and of itself is a huge barrier. But then your reactions to it, the things that you have felt and gone through, these silent pains that you've carried. One of the common ones that I hear with patients is that if I talk to a therapist about what I've been feeling, that there could be all kinds of consequences. Some of those consequences might be really specific. Like if I talk about this and I get a diagnosis, I might lose my job or I might lose access to my firearms. But then the stigma could also be around the kind of internal reactions that would happen if you start to talk about it. And that leads us to this idea of meta emotions. So, meta emotions are basically emotions about emotions. There are emotional reactions to our own emotions. And in the examples we'll go through are ones from patients that I've worked with. And when I do trauma focused therapy, so some types of therapy are really targeted towards addressing that avoidance cycle and trying to approach things that are hard to talk about so that over time, the anxiety, the intensity of the emotions lessens, and you can make sense of things that are otherwise unimaginable. And when we do this, it often happens that these meta emotions lie under these thoughts that are if then statements. So if I allow myself to be weak, then I would fall apart. So I can't do that. Or if I allow myself to remember and talk about what happened, what I saw, I'll go crazy and I won't be able to do my job or be there for my family. If I lose my temper, if I talk about these things, I'll lose my temper and then no one will want to be around me. Or if I lose my temper, it won't be safe for my loved ones to be around me and I need to protect them. And then, as Dr. Lowe mentioned earlier, I think there are some of the most incredible, wonderful things about being a responder that are kind of there's a coin flip, or there's both edges of the sword, where the being in the role to care for others makes it hard to accept help, to acknowledge when help might be needed. And that can come with thoughts like, I can't burden others. It's not fair to them. My job is to be there for my family, to be able to do my work well and take care of others. And then, as we're coming up on the 25th anniversary, I think survivor's guilt is something that is increasingly a cause of difficulty for many patients, as coworkers, friends, people that you love dearly have passed away from 9/11 related conditions. There's this sense that others had it much worse, and that you need to suck it up, that you're lucky to be here, or that to kind of get help, to accept defeat is not to honor their memory. So all of these things kind of exacerbate the challenge that's already there, um, to talk about, to connect, to not carry these burdens alone. And so now we're going to kind of move in the direction of thinking about next steps, pathways back to connection, how you can um, start to heal when these reactions have persisted for long periods of time for all the reasons we've discussed. And so, one thing I want to name is that healing often doesn't begin with feeling better. We can have this sense that once I feel better, I will be able to do all the things I've been wanting to do. I will be able to spend time with friends and family. I'll be able to call that person I haven't spoken to in years. I'll be able to go back to the motorcycle club. I'll be able to go back to playing basketball or football or soccer with friends. Um, and what we're actually kind of trying to show is that the opposite of the avoidance or withdrawal cycle, that the first step is often connection, feeling understood, realizing you're not alone, that other people feel this way, and that you can be understood, and that you can get through it. And that connection is often kind of the missing piece of the puzzle, or that helps you to re-engage, to do the things that you want to do, and to start to feel better. And then when you start to feel better, things become easier. So it's really the opposite cycle of connecting, starting to feel better, starting to feel able to do more, and that compounds on itself. And little by little, things become easier. So I want to share just a couple of stories or examples from patients I've worked with that I think will resonate with some of you, that I think are common and frequent experiences. So the first is this idea of keep moving. So a lot of patients, I think, that I work with had the experience of some time. For some people, it was immediately after or during their time responding, sometimes several years later. Some of these experiences that we're talking about, these stress reactions, they persist, they become overwhelming, and you start to withdraw. So this patient of mine had a time when they really started to feel lonely. They really started to feel the disconnection from their wife, from their family. And the way that they managed that is what I think is natural for so many people, is to kind of hide those feelings, to mask, not to burden others, to feel like they could get through it, embrace the suck and keep moving. And so they started taking on multiple jobs, taking overtime. Work is a place where they felt competent, they felt effective, it was meaningful, and they could kind of run away from some of the overwhelm, some of the memories, some of the feelings that they didn't know what to do with. And so the kind of burden stayed with them, always trying to outrun it. And I think that another experience that's quite common is feeling really triggered by the questions that are asked during monitoring visits. And that's there to kind of check in, to know how you're doing. And so for this patient, despite really struggling and having kind of recommendations for multiple years to pass along to the mental health side of the program, to do an intake with us, get some support. The reaction, the kind of instinct was to just keep going. And then over time, I think that it's hard to know, as Dr. Lowe said, um, when the timing is right, and that and it's never too late, and that eventually saying yes, getting the intake, coming to us, um, and that can be the beginning of connecting with someone who you don't know, who doesn't see it every day, where some of the perhaps shame and guilt is not present. That can be a really important step that then makes it easier to connect with people in your life. The other kind of story I want to share is about kind of using these stress reactions as a way to connect and get help. So another patient of mine has experiences often of kind of being in that freeze mode of there's a trigger, whether it's at a movie theater, whether it's news media, helicopters, sirens, something triggers, and there's a kind of freeze. And so the armadillo rolls up in a ball, pretends to be dead when there's threat. So this became a metaphor for this patient of when I'm triggered, I shut down. And it feels so natural to then withdraw from the many people in their life that could be there to help, to listen, to support, to check in. And sometimes that's days or weeks of kind of pulling away from relationships, struggling to get out of bed or do things. And so in our work together, this patient identified this kind of freeze mode as armadillo mode. And now it's almost a code word. When there's a trigger, when this freeze happens, they can share with significant others, family members, friends, I'm in armadillo mode. And that's a signal to them to give them a moment, give them time to kind of use different strategies and skills that we worked on in therapy to ground themselves, to reconnect to their body, to remember where they are and that they're safe. And then those loved ones are there to check in. They know what's happening and they're there for support. So that leads us to kind of what you can do. So I think it's really important to start with reconnecting with yourself. A lot of what we're talking about is the way that these silent pains and burdens can impact relationships and contribute to feelings of isolation and loneliness. But I think oftentimes the place we have to start is knowing that we are in distress, that this has been too much. And so a few kind of things that you can do on your own, doesn't require being in therapy or any kind of special sized support, is to make the shift from judgment, which is again a really normal way to react to emotions that are overwhelming or feel scary, is to respond to ourselves with judgment, self-criticism, shame. So to start to try to meet these emotional reactions with curiosity, that might be instead of saying what's wrong with me, or I'll never get better, or how am I gonna, I can't deal with this is my fault, asking things like what happened, thinking about the events, thinking about the evolution and what helped me to cope. Because alongside the stress reactions that maybe have persisted are many coping strategies that have been effective and helpful and gotten people through really challenging things. And then the next is to practice mindfulness. And there's lots of different definitions of mindfulness, but I like kind of keeping it simple, that all it is paying attention. So noticing things, but noticing them now, not going back to the past and remembering or thinking ahead to the future and worrying, but staying with what's coming up now and trying. And this is, I say trying because I think this is the challenging part, trying to do it without that judgment, without the criticism or shame or frustration with our feelings. And that can be paying attention to our thoughts, can be paying attention to physical sensations in our body, kind of scanning our body to notice, do I have a headache? Am I carrying tension? Is my chest heavy? Is my breathing short, shallow, rapid? Or am I calm? And sometimes it could be paying attention to our emotions. And then that leads to naming those emotions. So one of the things that we know is just giving a label to our emotions helps us to feel we have more control over them. Understanding it, knowing what's happening, makes emotions feel less overwhelming. So tuning into our body and our physical sensations, as well as kind of what's happening, to identify what's the emotion. Is this frustration? Is this anger? Am I feeling jealous of someone? Sad? Grief? Really getting in touch with what's underneath the feelings. And then I like the kind of idea of running a CAN report, which I think is something that might be familiar to some of you. Of what are the conditions? What are the circumstances? So what's happening in my environment, and what's happening in me? So have I been sleeping well? Do I have stressors going on? Was it a trigger, or am I just generally overwhelmed? Am I feeling disconnected? And then actions and needs. So when we can identify what's going on with us, we know what our emotions are, we've labeled our emotions, we can go on to make an action plan and take a step forward. What do I need to do? What is it that I'm needing? Am I needing to connect? Am I needing to exercise to kind of get rid of some energy? Am I needing to get support, get advice, and make a plan for how to do that step by step? And so before we move to kind of this idea of reconnecting with others, once we kind of connect with ourselves and we maybe make a step to being honest with ourselves about the distress that we're carrying, the kind of long-term impacts, there's still things that make it hard to connect with others. So I want to share this short video that helps to think about things that make it easier for us to find our way back to connecting with others when it's been hard to do for good reasons.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you can climb down. I know what it's like down here. And you're not alone. Sympathy is, ooh, it's bad, no. You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Okay. So I wanted to show that to speak to, in addition to everything that we've talked about in terms of the long-term impacts of stress reactions, how avoidance or withdrawal can kind of lead to exacerbation. We've talked about the impact of 9/11, the internal and external reactions, and how they can lead to disconnection, and some of the things that make it hard to talk about. But I think another thing that's really important is that some of the reasons it is hard to talk to people about these experiences, about emotional pain that is still there 25 years later, is because you've had experiences where people didn't get it. People didn't understand. There was pressure to just move on, just get over it, keep going. And so we internalize that. And so when we're thinking about connecting with others, I think it's really important to have in mind this distinction between empathy and sympathy, because that's the experience that makes it easier, excuse me, not harder, that makes it easier to take these little steps, to start to reconnect, to start to rebuild feeling of closeness and love and intimacy and joy. So it's been just a few minutes talking about that. The first place where I think you're able to kind of count on getting empathy is the 9/11 responder community, other responders who have been through similar things. When we realize that others have been through what we have been through, when you realize that there are so many people, friends, people you don't know, strangers who experience the same thing as you, it is very uplifting. It makes us feel like it is okay to feel that way. So the 9/11 responder community, whether that's through workplaces, through groups that exist within the program, lots of different ways to access it. But similarly, there are tons of peer supports. So things like AA or NA, alumni networks, kind of groups through unions, through work, through kind of many different peer supports, that can be a good place to start to reconnect, because it's a place where you can feel understood, be with people who've experienced similar challenges, and then that experience of connection makes the next step up the ladder easier. And then additionally is kind of seeking more formal social support. So individual therapy through our clinic, external providers through insurance, however it might be, group therapy in particular, because you get that experience of being understood, of being known by people who experience similar things, but also people who are willing to kind of call you out in ways that maybe friends, family members either are reluctant to do or don't do so well or so honestly or so clearly. And then social work case management services, getting tangible supports with all the many challenges is another important way to start connecting. And the reason I kind of added this image here is to highlight the importance of taking small steps. So it can start with making a plan to do one thing. It could be a call to one person that you've been thinking about and you haven't spoken to in some time. One activity that you used to enjoy that's social that you want to try to do. And it can be important to think about what step can I take that feels achievable. So that might be the thing that's easiest, that will make you feel good, that will make you feel pretty confident, even if it's hard to do it. Oh my God, I did it. Or maybe it's the thing that you're really motivated to do that's been hard to do. And you start with that step. And then when you take that small step, the next step becomes easier. And the other thing I think that's important with connection and relationships is that quality matters more than quantity. It's not about having a huge, massive support system or reconnecting with everyone. It's about finding those relationships where you'll be understood, you'll be supported, you can actually be honest, be vulnerable. You don't have to hide your feelings, and you can have that experience of empathy from others. Um, even one close relationship makes a huge difference in our experience of loneliness. It's not about how many relationships we have. It's about how seen we feel, how understood we feel in the relationships that are a part of our daily life. And so, lastly, I just want to end on this note of resources, of places, steps you can take to reconnect. If anything resonated today for you or people you know. So, when you do have medical visits with the health program, you can let those providers know. When you have your annual monitoring visits, you can speak to them about different types of support. You can reach out to your social work case manager with the program, or you can contact us directly, and we have both the phone number and the email there. Okay.
Thank you so much, Dr. Pfeffer, for um, providing this presentation and sharing so clearly the experiences of disconnection and the ways to reconnect. I think this really captures the experience of many of our program members. There are a couple of questions that I would like to just be able to speak to. Um, Someone shared, I want to share what I'm going through, but I'm really scared about what might come to the surface. Can treatment begin slowly? I need to know that I'm not going to be pushed past my limits. So that's a great question. And I think that it's one shared by many individuals who maybe have not been in therapy before, or maybe have, and it was not a positive experience. So we provide a whole variety of um, types of therapies, depending on the needs of the individual, depending on what is going to be best for you. And this is done in discussion with you so that we do not impose any sort of treatment on anyone. It's a conversation about what is going to be helpful to you. And that's part of the relationship, the trusting relationship that develops with your therapist. Um, is there anything you want to add to that, Dr. Pfeffer?
Yeah, I mean, I agree with everything you said. And I think maybe when I'm thinking about working with someone who's either new to therapy or perhaps coming in and realizing that they want to address or they need to address some of the things we've talked about today, some of these kind of traumatic stress reactions, and it feels really overwhelming, is to know that there are many different approaches. So there are approaches where we focus on the trauma. There are approaches that are more supportive in nature. There are many, many ways to explore and make meaning and understand what happened in a way that helps you to feel better. And also that it's really important that we could work together to think about how to pay attention to your experience and the level of distress. If we go back to this idea of window of tolerance, of checking in a lot and going slowly and having a buffer at the end of a session where you check in and you slow down and you do grounding, and so that the thing that maybe feels overwhelming can go slowly and at the pace that you're comfortable.
One thing that this brings to mind is that often patients will be very hesitant about participating in group therapy. For some, it feels intimidating or they feel much more uncomfortable. And could you just talk a little bit about the value of the group therapy experience?
Yes, happy to. I mean, I think that most, maybe, I mean, it's hard to ever say all unilaterally, but most patients that I've worked with who have kind of taken that step towards group or in groups that I've been a part of, um, find it to be the most helpful thing that they've experienced. That this connection that you can have, this experience of being understood by someone who's been through something similar, where there isn't the kind of pressures that we have with our personal relationships, our significant others and family members, where all of that is off the table. It permits a kind of openness to talk about things. And in one of my groups, I think everyone in the group frequently talks about how it's family. It feels like family. It feels like one of the places where they can be themselves, and some of the healthiest, most kind of supportive relationships they have in their lives. So I think it's hard to kind of emphasize enough how transformational groups can be, even if it's a little hard to dip your toe in the water.
Okay, thank you. Um, I think we are just about out of time. So I would like to once again thank you, Kendall, for being here, for sharing the information and your perspective and your insights, and also to thank those who have attended. And I really do hope that you were able to, in some ways, connect to what Dr. Pfeffer spoke about, and also a reminder that we are here. It's been 25 years. The program remains here. It remains here for you to support you, no matter what stage you're at or what your needs are. Please reach out and we will be happy to talk to you about what is available. So, on that note, I will say thank you to all, and we will stop here.